Hi, I am Patrick and I welcome you all once again to my channel. In this video, I'm going to convey to you the current COVID-19 cases in India and how life was before and how life is now. On 24th August 2019, on the streets of Bahadurgarh, people moved freely. People used not to wear nose masks because there wasn't any virus hunting them. The streets were always full to the brim with people. But as this pandemic came into existence, things has changed. Now you could see a lot of people not coming to town because they are afraid to lose their lives to COVID-19. Now most shops have been closed because of the second wave that is hitting the streets, and most people are trying to protect themselves and their families. People wear nose masks everywhere just to save their lives. Now, most of the markets have been closed, so the streets have turned to markets, and people try to sell and buy on the street side just to make ends meet and also to feed their families. COVID-19 second wave has devastated big cities like Bahadurgarh. 10th April 2021. This is how occupied Bahadurgarh was. At that time, the second wave wasn't hitting that much. This is how the streets also looked like on 5th May 2021. Mega marts used to be crowded with people, but now it's not so. It's really empty now. Groceries, nose masks, sanitizers, and some few other things are allowed to be sold in the supermarkets. I noticed that people used to come out around 5 o'clock p.m. to buy and sell. In some rural areas, due to inadequate health facilities, patients are lying on the roadside with fluid bottles hanging on trees. On 4th May 2021, in Gujarat, despite COVID restrictions, women in large numbers gathered to offer prayers at a temple.
By RWA President of the Society, Mr. Deepak. Mr. Deepak, what is the situation right now in your society?
Situation is completely beyond our control. We are not able to control the situation. At this point of time, we have approx 250 to 300 families affected. Families out of 1,002 families, approx 250 to 300 families affected, and cases are increasing day by day. Average 6 to 8 cases every day add up. Almost 4 to 5 critical cases every day. At this point of time, we don't have any oxygen. We have 8 oxygen cylinders, but all are empty at this point of time. For last 2-3 days, we are not able to get refill from anywhere. Yesterday evening, we have sent a team to Aligarh to get refill. They are on the way to return, but very pathetic situation to get a basic medical support.
Are you getting any support from district administration? Are you getting, they are able to manage you from few testing booths, some assistance on oxygen cylinders, or when you need beds, anything from administration, Deepak?
No. Last testing was done on 17th April. Prior to 17th April, there was few camps in society, and that was very helpful for us. On 17th April, almost 65 new patients was found corona positive in society itself. After 17th April, there was no testing. We have requested several times, but they are saying ki we don't have a kit at this point of time, so they are not able to manage a camp here. And no oxygen cylinder from district administration, no help, no guidance from district administration ki where we should go, where common man should go for the hospitalization. No.
And these are societies, high-rise societies in Ghaziabad, and they are really struggling. And as my camera person Pooja is showing you these visuals, more than 1,000 families are staying here, and out of these families, 300 are COVID positive, and the numbers are rising, and they're not getting any assistance from state government, from district administration. Though we all know that UP government has just conducted elections, the local elections, but these families are struggling, they are seeking help, they are pleading, begging, but they are not getting any assistance from district administration, from finding oxygen bed to getting a oxygen cylinder refilled. They are running pillar to post. In Ghaziabad, with Pooja, Saurabh Shukla.
Bengaluru, the situation as bad. Two tragic visuals today summing up what is the larger problem in the capital of Karnataka. Look at these visuals. A patient, actually her family drove her to the state assembly because they said they can't get a bed and it's the responsibility of the state to give her a bed. Her family members were protesting in front of the Vidhan Sauda, later joined by the Youth Congress as well. Finally, the Chief Secretary organized a bed for her. So I think that's a very powerful symbol there, that a patient and her family in an ambulance takes to the Vidhan Sauda and says, arrange a bed for her, it's your job. Also, in Bengaluru, a woman and her family went to the Chief Minister's house, again pleading for a bed. Again, while the Chief Minister organized a bed, but by that time it was too late. The patient had died. Just two visuals there epitomizing the struggle that is currently going on in India's Silicon Valley in Bengaluru.
Leave down a comment below and do not forget to check out the rest of my videos on this channel, PB Sencherey, and be sure to get subscribed so you don't miss my new videos.